Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Welcome back, everybody, to Vet Tales.
Hello.
Dr. Natalie Keith.
Dr. Josiah Dame.
And we're going to talk about rodenticides and also just like poisoning.
Touch on a couple other poisons, yeah.
Yeah, because it's a couple of the other ones aren't technically rodenticides, but we do use them to, unfortunately, like eliminate unwanted mammals, and then occasionally our pets get into it.
Yep.
So we're going to touch on those. The quick rundown, we're going to do anticoagulants, cholecalciferol or vitamin D3, bromethylene, zinc, calcium, strychnine, and antifreeze.
Yep.
I think that's it.
Yep.
So I miss the good old days. I'm old enough to remember.
Same.
Yeah.
It's been recent.
Yes. I mean, honestly, 5 years.
I guess I'm older now.
You are getting older now. Not as old as me. Never will be as old as me.
Time keeps marching on.
Doesn't it? So anticoagulants were the one that I saw the most of, and life was so straightforward for me, really. It was like, oh, your dog ate a green rat poison. Great. So what we need to do is cause it to throw up, and then let's start some vitamin K, and we'll monitor for bleeding issues, coagulopathy. So like red spots on the gum, pee in the urine, coughing.
There is an antidote.
And there's an antidote.
There's a vitamin.
Like we can do something.
A cheap one.
It's so cheap. It's easy and safe. And not even prescription, turns out.
Yeah.
Yeah, you just give them vitamin K. I think the biggest mistake people would make originally with those is as the rodenticide, arsenal was adjusting over time, they were using longer acting anticoagulants. Yeah. And so historically we would use vitamin K for a week, but some of the longer acting ones actually can persist in the system for 3 weeks. And what's happening is that it's interrupting the clotting cascade by binding the existing vitamin K or some mechanism of that, interrupting the vitamin K's mechanism of action. And so you're having to every day replace new vitamin K into the system to make the clotting cascade work. Otherwise, clotting doesn't occur. And so people think, oh, it's been a few days, no bleeding, no problem. And they'll stop the vitamin K, and then the bleeding starts.
Yeah. I'm always like, here's 30 days. Don't.
Yeah. Do not stop. Risk death.
Mm-hmm.
And then typically what I would do is make them come back 48 hours post stopping vitamin K to make sure that the dog was indeed operating properly with its clotting cascade, which we check with what's called a PTPTT, prothrombin times. Prothrombin. PTPTT, coag profile. And that tells us whether or not both the first and second clotting cascade are acting properly. So there's a whole lot of reasons a dog could have issues with clotting. And so that's just, the clotting cascade is one of them. Lack of platelets is another, and that is a totally different topic for a totally different day.
Yep. Well, Dr. Keith, what would I do if I got home from work and my dog, it had been like 6 hours since he ate it? Would you make him vomit?
Yeah, so that's a great question because a lot of times we don't know when they ate it.
Mm-hmm.
I typically operate on the side of caution. And if I think, like, if you've just been gone 6 hours, I think, well, maybe you just ate it.
Just ate it, yeah.
And I'll make it. But if it's like, let's say, it's been 24 hours or whatever, then there's really no point. It's already processed through the stomach. Vomiting isn't going to help anymore. And we move on to things like activated charcoal and fluid therapy to flush the system, bind to existing toxins that might still be in the small intestinal tract, and then vitamin K.
Yeah.
Till the cows come home.
Then again, as of late, they don't really make the anticoagulant rodenticides anymore. They've transitioned to creating a couple other kinds. So the most common one that I've been seeing is bromethylene, but Dr. Keith just saw the vitamin D3 rodenticide.
Rodenticide, yeah.
I'll go into that.
Can I just say for a second, is it terrifying to anybody else that they're using this cholecalciferol vitamin D3 to kill mammals, but like we take it all, like I take vitamin D every day.
Everything is dose.
It is dose, but it takes such, the way that they are formulating these, it takes such a small dose to be fatal. And it's a really interesting mechanism of action because it's causing calcification of the kidney. So this is why it scares me. Because I've had 2 cases, actually. One just recently, and then another one last summer before we moved, or last spring, because it was before we moved into the new building. And the first dog, there was no history of anything wrong. She was like a 5-year-old, big, large, like 70-pound Shepherdie mixed something. And she just got sick to her stomach, threw up a couple of times. Owners were like, dogs throw up. And she didn't want to eat and drink. This goes on for like, by day 3, that she's like just feeling puny and doesn't want to eat anymore, has thrown up again. And they're like, this is weird. We've got to take her in. This isn't normal tummy upset. And they bring her in and she is in full renal failure. There's just no coming back from this. And unfortunately, that dog passed away. And on necropsy, which is where we look at them post-mortem to examine what happened, her kidneys were literally rocks. Like the calcification is terrifying. Most recently, I had a puppy that owner knew, because a lot of times owners have no idea their dogs have been poisoned. In fact, they will swear to you there is no way it could have happened. Yeah.
We forget about like the way back in the shed from the previous house.
It's always, I feel like every time we just moved within the past 6 months. Yeah. And then, something in the season has changed, their lifestyle has changed. They're going out to an area they hadn't gone before, whatever. And so this one puppy gets out, and there was several puppies in the pen, and only one of them got out, and she consumed this green bait. And at first he thought it was just like a normal rat poison, like we think of the anticoagulants. And I ran blood work on her because I was like, this doesn't make sense. She's way mopier. And she was still throwing up the next day because he made her throw up the day before when it happened, because he called it animal or poison control. Yep. And they said induced vomiting, immediately induced vomiting, lots of green puke comes up. So yay, we got it out. But the next day, she's still throwing up and still sick. And I was like, this isn't normal. Yeah. So he let me run blood work. And sure enough, her kidney values were high. And we tried aggressive therapy to try to pull her through. And unfortunately, she did not survive. There is no antidote to this. It is just fluid therapy. And then there's also like all these crazy things that you can do in terms of managing their blood calcium levels. Like you can do steroids. Just trying to think, there are specific, like if for example, the dose is greater than 0.5 mg per kg, which most of the time you have no idea how much they've ingested, then you're having to, there's like this, it's called cholecalciferol, I guess, to help make it to where it's not going through the liver to be processed, to circumvent intrahepatic circulation. And then you're alternating charcoal doses, and honestly, it's a wish and a prayer. Yeah. It really is, and it's devastating that, to me as a veterinarian, it's devastating that we are using rodenticides that don't have an antidote. The label, he showed me a picture of it, and even said pet and child resistant. And I said, sir, I think that means the packaging.
The packaging, yes.
Which clearly was not.
Yeah. And I'll say this, I think, don't quote me, like I'm not totally for certain for this, but I believe the push to move away from the warfarin and the vitamin K rodenticides is the clotting rodenticides is because of wildlife. So there's fears that like birds that were eating.
Well, but how is this helping?
Continue to run.
Because I know it is like industry changes that are probably being mandated, but I'm like,
yeah, I think it's the wild population is what they're worried about.
The way it's transferring through the dead animal?
Yeah. And I don't know the specifics, but I know that because the vitamin K can take a couple days for them to die, like owls and things are eating those rats and then getting sick from it. So they are trying to transition to something that works faster. Quickly? Yeah.
So they won't eat the dead animal? Do they not? I mean, some animals eat dead animals. Listen, this isn't my field. So if anybody knows
more.
I'm
not a wildlife veterinarian. Yeah. I know exactly why.
Or a toxicologist.
But I don't know exactly why they're transitioning, but it's definitely tough because then it rolls into bromethylene.
Yes, bromethylene.
So bromethylene, I've had good luck with, thankfully, when it comes to dogs getting into it. So that's the most common new age rodenticide is bromethylene. It is more of like a neurotoxin. So it's going to cause brain swelling in our dogs and cats who get into it. If most of the time, if they're going to get to me within 4 to 6 hours and I get them to vomit, I have not really seen reactions to it. But essentially with this rodenticide, you're going to see brain swelling, seizures, neuroscience. You can get a delayed like liver injury, which I have not personally seen, but I usually will be like, if you want to be extra safe, come back in 2 weeks, we'll repeat lab work, or of course sooner if they're not feeling better. But normally with this one, we're going to get you in, we're going to make them vomit, and then we're going to hook them up to IV fluids maybe for 24 hours, do some charcoal, and that's really it.
And have you ever had any come that were already neurologic?
No.
Yeah.
Thankfully,
Dr. Goodall had one.
I've been really lucky.
But that's been, oh my gosh, a while ago now, like maybe 3 years ago. And
mannitol.
Oh yeah, mannitol, fluids. We were giving like diazepam to control seizures. It's
a disaster.
Intense. Do not recommend. 1 out of 5 stars.
And really the big takeaway with the rodenticides, because now there's kind of like 3, and if it's the coagulation one, it's usually old. So it's like, I had an older client, and I was like, hey, like which rodenticides, please give me the package. And thankfully it was the
anticoagulant.
But usually people are bringing in now bromethylene or the vitamin D3 one, and bromethylene being the most common. So bring the package with you if you can.
Yeah.
Because otherwise, I mean, worst case, I'm going to just send home vitamin K if I don't know if it's bromethylene or...
Yeah. I agree. That's exactly right. If you're not sure, we err on the side of caution with giving vitamin K after we do all the other supportive cares. Yeah, there's no reason to not. Like, you're not going to hurt the patient if it doesn't need the vitamin K. It's just going to process it and eliminate it, and it's no big deal. Or it could be saving its life, and you don't know, because most of the time, it's not poison you knew was out. And so, which is another reason we a lot of times insist on running blood work on these vomiting dogs, because 30%, studies show that 30% of owners of dogs or cats, supposedly, but I think this was done on dogs, that have an animal that has been confirmed with a rodenticide toxin in its body, 30% of the owners swear there is no way that could be possible. Because we don't know what we don't know. And these animals they smell it, and they find it, and they eat it, and there you have it. So the fourth one, I've never seen before. This is like a mole or gopher bait, which I usually think of as being strychnine, but this is actually talking about zinc, calcium, and aluminum phosphides, which is fascinating, not in a good way, because it makes a toxic phosphine gas. And so then the treatment plan is to actually do gastric lavage, but you have to be really careful because the hospital personnel that is being exposed to the gas that's being lavaged out of the stomach is a potent respiratory irritant. So then you got this issue with that. They do say, inducing vomiting is a good idea by the veterinary professionals, not by pet owners, and you need to be outside to do it. It takes a very, very little bit of this mole and gopher bait to be very, very dangerous to the dog and anybody around whenever the gas is coming out. So
yes, we learned about that in school. And they're like, just be cautious. And I was like, new fear.
Yeah, new fear. I know. Oh my gosh, I was this tangent, but I was doing my accreditation CE, and they were like, please note that 75% of emerging diseases are zoonotic. And I was like, noted. Meaning basically, we can all, zoonotic meaning people can get it from animals. So
about bird flu.
Bird flu, maybe we'll throw in a teaser at the end of this. We're cranking through these guys because it's like no antidote, no treatment, IV fluids, wish and a prayer, induced vomiting, unless it's zinc, calcium, and aluminum phosphides, in which case we won't know. Actually, you still are supposed to induce vomiting, but outside.
And be very careful.
Yeah.
And don't breathe it in.
Yes.
They taught us that in school. I was like, how? No.
You won't. Oh, I love. Okay, so speaking of moles and gophers, strychnine toxicosis is another one. I actually have seen strychnine in a few patients. Yeah. It is known for its clinical symptoms of aggressive seizure activity that actually are worsened by stimulation. So if you close the door loudly or clap your hands, it'll set off another seizure. So these dogs, obviously, again, if this is a pop quiz, what do we do first?
Vomit.
Induce
vomiting. I was like, am I going to get it wrong?
Josiah missed a quiz at lunch today. I got it right. I did. I won. Yay. So anyway, yes, you did. You induced vomiting and then IV fluids, of course. But the big difference in this guy is that we use things like methocarbamol or diazepam to stop the muscle clenching with the muscle relaxing methocarbamol, or how do human medicine people say it?
Methocarbamol?
Yeah, maybe methocarbamol. Yeah.
I'm not 100% trust to pronounce words, guys.
Yeah, so we don't know. But anyway.
So when you go into a bunch of seizures over and over again, what do you call it?
It's called status epilepticus.
So my whole life, I've been a veterinarian for 5 years, I think, about that. I've been a technician for an assistant, 8 years before that. Status ellipticus is what I called it. All the way through vet
What's
school.
so funny about this story is that Josiah, Dr. Dame, comes back from being Dr. Dame after having been Josiah for the 8 years. And then we have the 4 years and 3 years that he's gone. And he comes back and he's talking about a pet and he says, the status ellipticus. And I went, oh crap, I've been saying it wrong this whole time.
No.
Looked it up and I was like, no, it's him.
No, it's me, guys. If I can say it wrong, I'm going to say it wrong.
Yeah. So anyway, carbamol is what I say.
Esophagus.
Esophagus?
Skeletal. Skeleton.
Oh my gosh.
Oh, sorry.
Yeah, you just sound like you're from a different country. Okay, so basically, controlling the seizure activity is absolutely a must with these guys.
The rough road.
Yeah, sometimes we use Kebra, people use diazepam, just anything you can do to stop.
Supportive care.
You can even induce comas if you have to. Phenobarbital is a last-ditch effort. Propofol will be before that. And you just really try to keep them calm and then wait for it to clear the system. And it can take a long time. They were even talking about IV lipid emulsion therapy.
CK.
Yeah, which is sort of adjacent to the ethylene glycol treatment plans in a weird way.
Yeah.
Talking about basically getting it to displace.
Yeah.
Okay, so speaking of ethylene glycol, or as y'all call it, it's the last one. You guys would know this to be antifreeze.
Yes.
Very sweet. Tastes like sugar.
That's why it's
the kitty cats like to lap it up.
Cats have the
under the
toughest time.
Yeah, they do. Although my own personal dog, many moons ago when I was a tech, so I would say 20 years ago, she got into antifreeze. Question mark on how. And the hallmark for these guys, they'll come in staggering like they're drunk.
Yep.
And then if you do nothing, eventually it just causes full-on renal failure within a day or two. Like kidneys, donesies, done. No coming back.
No.
She was 9, I think, when this happened, and she lived to be 17 and did not die of anything related to kidneys. She was a tough
I'll just preserve.
That was just not kill you, makes you stronger. Yeah. Definitely apply it in this case. Anyway, yeah, it's wild. So we, induce vomiting, put her on fluids, and then you just wait. But the interesting thing was back in those days, especially what we did for the antidote was Everclear.
Mm-hmm.
Will you talk about this? You get this idea better than me.
Yeah. So ethylene glycol itself is not toxic technically. It's when it then gets converted by the alcohol enzyme in our body that converts alcohol to a metabolite. That conversion is then toxic and then it breaks down. So there's 2 antidotes basically. There's let me say it real quick.
Oh, sorry. I don't have it on that page. I was just reading about the calcium oxalate crystals, which while we're looking here, it's right here.
Yeah.
It's
a really tough one for me to say, so cut back to me having trouble saying words.
Yeah. Where'd it go?
There it is.
Okay. Fomepizole.
So fomepizole is the fancy, if you got it, cool drug that it was made by a drug company.
Yeah.
And some ERs were carrying it. There's been a moment where I think it was backordered because I had called around to a lot of the ERs around here and they just not have it. And I was like, fine. I'm like, what are y'all using? And they're like, Everclear. That's
Everclear. Yeah.
Because the goal of this kind of antidote in quotations is you're overwhelming the body. You're making them more drunk, but you're giving Everclear IV essentially, and you are overwhelming the liver and that alcohol enzyme to break down Everclear and not the actually ethylene glycol.
Right.
But you have to catch them quick.
Right.
They have to, when they're drunk, when you find them drunk it might be too late.
Yeah.
And so it is a tough.
But not always.
Not always. And it's still worth trying, but it's tough.
Yeah.
Yeah.
Yeah. It's interesting. The mechanism of that, whenever that metabolite is created, its byproduct is this little calcium oxalate monohydrate crystal. And it is pathognomonic, meaning when you see that crystal it's produced in the urine. So you'll find it in the urine. You know that it is antifreeze.
It's like a picket fence.
Oh, it does look like a picket fence. And there was a song we used to sing in
DC.
Yeah, or ACVP. ACVP was a spinoff. So our pathologist would make songs to help us remember all of the things we had to learn. And there was a calcium oxalate monohydrate. And that's all I really remember. But I sing it. It's like something like 80s.
Yeah.
Big band.
Yeah.
I don't know, Dr. Richie, if you ever listen to this podcast, please forgive me for having. Yeah.
The one that's always stuck in my head is knock, knock, knocking at the door.
Yeah. I told you I was a backup singer.
Yes.
In this, and then we called ourselves the Numa Sisters, like long, P-N-E-U. Anyway, so yeah, we thought we were very clever. Anyway, I digress. The point is the calcium oxalate monohydrate crystals are pathognomonic, but that means what's happening is that there's crystallization, calcification happening in the kidney. So it's really, really, the renal tubules specifically, very, very similar situation to what you see with the vitamin D toxicosis. So when I first saw this patient, which has been almost a couple years ago now, whatever I said, a year and a half, whatever, it's before we moved into the new building,
Is this the one that filled with urine?
I don't think so.
You had a...
Yeah, was she? Yeah.
No, I think it's a different one. I think we had a true ethylene glycol toxicity because I remember us finding the picket fence, but her abdomen, we tried to treat.
Yeah.
The following day, her abdomen was full of...
Is this when you were a technician?
No, this was last year.
Man.
And her abdomen was full of urine because her ureters had crystallized and broke.
Oh, I don't remember.
And her belly filled with those. It
was it in an old building or the new building?
It was in the post-tornado boarding.
Yeah, okay. So maybe it was her then.
Okay.
Well, I don't know. This is terrifying.
Both of them, yes, present similarly.
They do absolutely present similarly. And I was really confused at first because I was like, why am I not seeing the crystals? And then realized, this is what's going to happen whenever I have these cholecalciferol cases. Yeah. So, so many toxins out there. So when we're like, hey, we just like harmful and we're going your dog that's throwing up, just be like, sure, we get it.
And then also, if you know that they ate the toxin, bring the packaging.
Yeah.
Try to find the packaging.
Yeah. And if it's the guy that lost the puppy, he did everything he needed to do. Like the puppy got out of the enclosure. These things happen. Found bait he didn't know was there because they had just moved to the property a couple of months ago. These things happen. So then he grabbed the package and he called should I keep doing that? Yes, the poison control. And they told him to induce vomiting, and he did. It was just, unfortunately, the volume that dog had adjusted on a teeny tiny puppy body was just too much. But he did all of the right things. And then, sure enough, the only lag time was I was like, this blood work doesn't make sense. Can you please get me that package? And he went home, found it, took pictures, sent it to me. And I was like, yep, that's the problem. So anyway, so that's, the very, and lift you up talk on pet toxins. It's like, I didn't realize it was going to be so depressing. That's why I miss the good old fashioned anticoagulation.
Me too. And I don't want anybody to eat them, but
if I had a dog eat one, I would pick that one.
Mm-hmm.
So I think I've told this story before on the podcast, but I also had a dog that was poisoned by our neighbor with anticoagulant rat poison.
You had a neighbor?
Yeah, I had a neighbor. This was back when we lived out on River Road. And I know, it just sounds bad, doesn't it? It's actually Brangus, but around the corner is River Road. Anyway, You can GPS map that if you're one of those people. So basically, the neighbor...
So I was just doing some Googling real quick about the bromethylene. It's because it kills them faster. That's why.
That is why.
That's why it's so sorry.
Okay, because the hope is that the birds won't eat the already dead mouse. Because it'll maybe die.
They literally were calling it dead mouse walking is what would happen with the other mice.
Yeah, they would.
it's significantly reduced with the bromethylene compared to the warfarin.
And dogs, as it turns out.
Yeah.
Love that.
Okay.
So anyway, no, it's okay. So basically, Bill was our dog, which he did not die at this. Yeah.
I remember this.
Yeah. And he goes out in the yard and we look outside and there's this bucket and we're like, that's not our bucket. What's our bucket? I mean, a bucket, like probably 3 gallons, 2 anyway. I don't know. It was bigger than 1. And it's in the morning in the springtime. And we had this old guy he was just, I think he had dementia. So I'm trying to give him some grace here because he would talk to us he would tell us all the time, quit cutting down those trees. But we'd never cut a tree down before in our life. So we were a little unclear on what the guidance was for. So I just think he had dementia. But either way, he walked, you could see his little footprints in the dew. We had a gate that was adjoining, so you could walk from his property to ours, I lived on 10 acres, not uncommon to have that. So he walks through the gate and you see his little shuffling feet up to the tree, sets down the bucket and you see his little shuffling feet back to the house. But luckily, by the dew tracks, we could tell it hadn't been long. So we knew that Bill had just eaten it, within that 20-minute period. And so I make him throw up. You can Google how to do that, but hydrogen peroxide or salt will usually get you there. And so I gave him hydrogen peroxide and he pukes it all up and then gave him vitamin K for 3 weeks. And that was the end of the story. Left the whole bucket, in dew tracks. Oh, neighbors. Anyway, good fences. So, okay, just very quickly, and then we have to go. Do you want to do a teaser on bird flu?
Okay, just teaser. Really big, takeaway, red letter sign blinking.
Flashing.
They are getting domestic indoor cats are getting bird flu from raw turkey chicken diets.
Yep.
So just taste that and digest it.
Oh, pun intended?
Pun intended.
Okay.
We do not recommend raw diets.
We don't.
You can go back and listen to our food episode, but there is no scientific data that proves that it is good for them. Our pets are not wild animals. They're domesticated. Their tummies are not built to cook the food.
Their DNA has definitely changed over time in terms of their ability to handle that. And then, additionally, I like to point out...
Freeze-dried is also still raw. That's a big thing.
Freeze-dried.
Raw, it's freeze-dried.
Freeze-dried is not cooked. It is still raw and can still harbor deadly viruses and bacteria, E. coli and salmonella. I mean, I've seen case after case from raw diet consumption. And I think that a couple of things that I've taken that I try to give perspective on, because I know people make that decision to do raw food very consciously. They've thought a lot about it. They're very intentional about it. So I don't want to minimize that. But also, I've seen coyotes from the wild on necropsy, and they have a lot of problems, and they die very young, and they have a lot of intestinal parasite burdens, and their coats are in bad condition from their burdens of the parasites that they're taking on, and it's just like us in the wild.
Yeah, it's not worth it, but I do love the drive, and I tend to shift
the passion is great.
Passion for a home cooked meal, even. So just translating that to a cooked home meal using Balance It to make sure it's completely balanced diet is the direction we want you to go.
Or Farmer's Dog. I love that stuff.
Dog, and that is all good because it's cooked. And
the E. coli and salmonella risk is real to your pet and then subsequently to you.
Yeah,
you can get it from them.
CDC has a lot of good.
So that was a hard tangent off of bird flu. But the point is, cats have been reported to be getting the bird flu from raw or freeze-dried cat food.
Yes.
Or, poultry in general.
Poultry. Yeah, turkey. I think the big one was turkey.
Yeah. So just a little teaser warning. And that's all we have for today. I don't think we said anything uplifting. So
we didn't even laugh as much as we do.
It's so true. Oh my gosh.
This is a serious episode.
So serious.
Toxicities are serious.
It's tragic.
And ethylene glycol is the worst. And I've seen neighbors do.
Yeah, these are real things.
Glycol, and it's not good.
It's not. So, but we're here to help. And, if you ever find yourself in this situation, you now know to induce vomiting and call your vet ASAP.
Yep.
Cool.
Or ER for closed.
Don't wait.
Don't wait.
Yeah. All right. Okay. Bye, guys.